from the U.S. Food and Drug Administration. URL is www.fda.gov/investigational-new-drug-categories. General drug categories. Investigational new drug IND application. Content current as of December 7, 2015. Starting off with
analgesics.
Analgesics, drugs that relieve pain. There are two main types: non-narcotic analgesics for mild pain and narcotic analgesics for severe pain. Antacids, drugs that relieve indigestion and heartburn by neutralizing stomach acid. Anti-anxiety drugs, drugs that suppress anxiety and relax muscles, sometimes called anxiolytics, sedatives, or minor tranquilizers. Antiarrhythmics, drugs used to control irregularities of heartbeat. Antibacterials, drugs used to treat infections. Antibiotics, drugs made from naturally occurring and synthetic substances that combat bacterial infection. Some antibiotics are effective only against limited types of bacteria. Others, known as broad-spectrum antibiotics, are effective against a wide range of bacteria. Anticoagulants and thrombolytics. Anticoagulants prevent blood from clotting. Thrombolytics help dissolve and disperse blood clots and may be prescribed for patients with recent arterial or venous thrombosis. Venous thrombosis. Anticonvulsants, drugs that prevent epileptic seizures. Antidepressants. There are three main groups of mood-lifting antidepressants: tricyclics, monoamine oxidase inhibitors, and selective serotonin reuptake inhibitors, SSRIs. Antidiarrheals, drugs used for the relief of diarrhea. Two main types of antidiarrheal preparations are simple absorbent substances and drugs that slow down the contractions of the bowel muscles so that the contents are propelled more slowly. Antiemetics, drugs used to treat nausea and vomiting. Antifungals, drugs used to treat fungal infections, the most common of which affect the hair, skin, nails, or mucous membranes. Antihistamines, drugs used primarily to counteract the effects of histamine, one of the chemicals involved in allergic reactions. Antihypertensives, drugs that lower blood pressure. The type of hypertensives currently marketed include diuretics, beta blockers, calcium channel blocker, ACE, angiotensin converting enzyme, ACE inhibitors, centrally acting antihypertensives, and sympatholytics. Anti-inflammatories, drugs used to reduce inflammation, the redness, heat, swelling, and increased blood flow found in infections and in many chronic non-infective diseases such as rheumatoid arthritis and gout. Anti-neoplastics, drugs used to treat cancer. Antipsychotics, drugs used to treat symptoms of severe psychiatric disorders. These drugs are sometimes called major tranquilizers. Antipyretics, drugs that reduce fever. Antivirals, drugs used to treat viral infections or to provide temporary protection against infections such as influenza. Barbiturates, see quote sleeping drugs end quote. Beta blockers, beta adrenergic blocking agents, or beta blockers for short, reduce the oxygen needs of the heart by reducing heartbeat rate. Bronchodilators, drugs that open up the bronchial tubes within the lungs when the tubes have become narrowed by muscle spasm. Bronchodilators ease breathing in diseases such as asthma. Cold cures. Although there is no drug that can cure a cold, the aches, pains, and fevers that accompany a cold can be relieved by aspirin or acetaminophen, often accompanied by a decongestant, antihistamine, and sometimes caffeine. Corticosteroids. These hormonal preparations are used primarily as anti-inflammatories in arthritis or asthma or as immunosuppressives, but they are also useful for treating some malignancies or compensating for a deficiency of natural hormones in disorders such as Addison's disease. Cough suppressants. Some simple cough medicines, which contain substances such as honey, glycerine, or methanol, soothe throat irritation but do not actually suppress coughing. They are most soothing when taken as lozenges and dissolved in the mouth. As liquids, they are probably swallowed too quickly to be effective. If few drugs are actually cough suppressants, There are two groups of cough suppressants: those that alter the consistency or production of phlegm, such as mucolytics and expectorants, and those that suppress the coughing reflex, such as codeine, narcotic cough suppressants, antihistamines, dextromethorphan, and isoproterenol, non-narcotic cough suppressants. Cytotoxics, drugs that kill or damage cells. Cytotoxics are used as anti-neoplastics, drugs used to treat cancer, and also as immunosuppressives. Decongestants, drugs that reduce swelling of the mucous membranes that line the nose by constricting blood vessels, thus relieving nasal stuffiness. Diuretics, drugs that increase the quality of urine produced by the kidneys and passed out of the body, thus ridding the body of excessive fluid. Diuretics reduce water logging of the tissues caused by fluid retention in disorders of the heart, kidneys, and liver. They are useful in treating mild cases of high blood pressure. Expectorant, a drug that simulates the flow of saliva and promotes coughing to eliminate phlegm from the respiratory tract. Hormones, chemicals produced naturally by the endocrine glands: thyroid, adrenal, ovary, testes, pancreas, parathyroid. Parathyroid. In some disorders, for example, diabetes mellitus, in which too little of a particular hormone is produced, synthetic equivalents or natural hormone extracts are prescribed to restore the deficiency. Such treatment is known as hormone replacement therapy. Hypoglycemics, in parentheses, oral, end parentheses. Drugs that lower the level of glucose in the blood. Oral hypoglycemic drugs are used in diabetes mellitus if it cannot be controlled by diet alone, but does require treatment with injections of insulin. Immunosuppressives, drugs that prevent or reduce the body's normal reaction to invasion by disease or by foreign tissues. Immunosuppressives are used to treat autoimmune diseases, in which the body's defenses work abnormally and attack its own tissues, and to help prevent rejection of organ transplants. Laxatives, drugs that increase the frequency and ease of bowel movements, either by stimulating the bowel wall, stimulant laxative, by increasing the bulk of bowel contents, bulk laxative, or by lubricating them, stool softeners, or bowel movement softeners. Laxatives may be taken by mouth or directly into the lower bowel as suppositories or enemas. If laxatives are taken regularly, the bowels may ultimately become unable to work properly without them. Muscle relaxants. Drugs that relieve muscle spasms in disorders such as backache. Anti-anxiety drugs, minor tranquilizers that also have a muscle relaxant action are used most commonly. Sedatives. Same as anti-anxiety drugs. Sex hormones, in parentheses, female. There are two groups of these hormones: estrogens and progesterone, which are responsible for the development of female secondary sexual characteristics. Small quantities are also produced in males. As drugs, female sex hormones are used to treat menstrual and menopausal disorders and are also used as oral contraceptives. Estrogens may be used to treat cancer of the breast or prostate. Progestins, synthetic progesterone, to treat endometriosis. Sex hormones, in parentheses, male. Androgenic hormones, of which the most powerful is testosterone, are responsible for development of male secondary sexual characteristics. Small quantities are also produced in females. As drugs, male sex hormones are given to compensate for hormonal deficiency in hypopituitarism.
Hypopituitarism.
Or disorders of the testes. They may be used to treat breast cancer in women, but either synthetic derivatives called anabolic steroids, which have less marked side effects, or specific anti-estrogens are often preferred. Anabolic steroids also have a, quote, bodybuilding, end quote, effect that has led to their, usually non-sanctioned, use in competitive sports for both men and women. Sleeping drugs. The two main groups of drugs that are used to induce sleep are benzodiazepines, and barbiturates. All such drugs have a sedative effect in low doses and are effective sleeping medications in higher doses.
Benzodiazepines.
Drugs are used more widely than barbiturates because they are safer. The side effects are less marked, and there is less risk of eventual physical dependence. Tranquilizer. This is a term commonly used to describe any drug that has a calming or sedative effect. However, the drugs that are sometimes called minor tranquilizers should be called anti-anxiety drugs, and the drugs that are sometimes called major tranquilizers should be called antipsychotics. Vitamins. Chemicals essential in small quantities for good health. Some vitamins are not manufactured by the body, but adequate quantities are present in a normal diet. People whose diets are inadequate or who have digestive tract or liver disorders may need to take supplementary vitamins. This is from Cambridge University Press. Link should be in the description. Title is Examining the Gateway Hypothesis, Stages and Pathways of Drug Involvement. Published online by Cambridge University Press, 25 July 2009, by Denise B. Candle. Edited by Denise B. Candle. Summary. The notion that there are developmental stages and sequences of involvement in drugs was first advanced a quarter of a century ago. Hamburg, Kramer, and Jank, 1975. Candle, 1975. According to this notion, there is a progressive and hierarchical sequence of stages of drug use that begins with tobacco or alcohol, two classes of drugs that are legal, and proceeds to marijuana, and from marijuana to other illicit drugs, such as cocaine, methamphetamines, and heroin. The basic premise of the developmental stage hypothesis is that involvement in various classes of drugs is not opportunistic, but follows definite pathways. An individual who participates in one drug behavior is at risk of progressing to another. The notion of developmental stages in drug behavior does not imply, however, that these stages are either obligatory or universal, nor that all persons must progress through each in turn. In the early 1980s, the term gateway drug began to be used to refer to alcohol and cigarettes, the drugs that are used prior to the use of illicit drugs. Soon, the usage was extended to include the use of marijuana as a precursor to the use of other illicit drugs, such as cocaine or heroin, and more rarely even to cocaine as a precursor to heroin. It is not clear how the term gateway drug originated, and I could not locate any relevant literature. Information. Type chapter. Information. Stages and pathways of drug involvement. Examining the gateway hypothesis. Pages 3 through 16. Publisher, Cambridge University Press. Print publication year 2002. From Scientific Direct. Hypnotic. A hypnotic is a pharmacological agent that depresses the central nervous system and is commonly used to promote sleep, especially by individuals with insomnia or anxiety. AI-generated definition based on Sleep Medicine Reviews, 2021. Now I will read this definition from this article entitled Effects of Hypnotics on Obstructive Sleep Apnea, Endotypes and Severity. Novel Insights into Pathophysiology and Treatment. Hypnotics. Hypnotics are pharmacological agents that depress the central nervous system, CNS, and promote sleep. Footnote 63. Thus, they are commonly used by people with complaints of sleep disruption. Sleep disruption is common in the general population. Indeed, more than 12% report the need for treatment for sleep difficulties. Footnote 64. And 6% report hypnotic use within the past month. Footnotes 65 and 66. Hypnotics are primarily prescribed for individuals with insomnia or anxiety. Footnote 67. The use of hypnotics is also greater in obese, greater than 7%, and elderly, greater than 9%, people, two groups at an increased risk of OSA. Footnote 66. OSA means obstructive sleep apnea. Definition: obstructive sleep apnea, OSA, is defined as a sleep disorder characterized by episodes of partial or complete upper airway closure during sleep, leading to breathing cessation or reduced airflow for 10 or more seconds. This condition often results in loud snoring and can significantly disrupt sleep quality while reducing oxygen flow to the organs. Resuming the reading. Additionally, over 40% of people with OSA are also estimated to have concurrent insomnia and thus are more likely to be exposed to hypnotic use. Footnote 68, footnote 69, footnote 70, and footnote 71. Therefore, as many people with OSA remain undiagnosed and may use hypnotics to treat their concurrent sleep difficulties, footnote 72, it is pertinent to determine the effects of hypnotics on OSA severity, pathophysiology, and next-day symptoms and side effects. Indeed, the safety profile of common hypnotics have generally been established in healthy individuals. The elderly and people with insomnia, given the likely high rates of hypnotic use in people with OSA, it is also important to understand the safety profile of hypnotics in this cohort. Classes of hypnotics. Common hypnotic drugs primarily target the GABAergic system. Footnotes 67, footnote 73, and footnote 74. The GABAergic system, or the GABAergic system, or the GABAergic system, is defined as the principal inhibitory neurotransmitter system in the mammalian brain, primarily mediated by GABA or GABA-A and GABA-B receptors, which play a crucial role in synchronizing cortical network activity and are involved in various physiological and behavioral processes, including learning and memory. Resuming the reading. Benzodiazepines have largely replaced older hypnotic drugs such as barbiturates, given their more favorable safety profile. Footnote 67. However, non-benzodiazepines, often referred to as quote Z drugs, as the chemical names of these drugs usually begin with Z. Melatonin agonists, via the suppression of the activity of the brain's circadian clock. Some antidepressants, such as trazodone, and antihistamines are also commonly used for their sedative properties. Footnote 67. More recently, orexin antagonists have also been developed as sleep promotion aids, primarily for people with insomnia. Footnote 75. This review focuses on studies that have investigated the effects of hypnotics on sleep, breathing, and upper airway physiology in people with OSA. From Britannica.com. Psychotropic-drug pharmacology, also known as mind-altering drug, psychoactive drug. Don Vaughn, Britannica editors, March 23, 2026. Psychotropic drug. In pharmacology, any agent that induces changes in awareness, behavior, mood, perception, or sensation. Most psychotropic drugs are classified as one of 5 different types: anti-anxiety agents, antidepressants, antipsychotics, hypnotics, or mood-stabilizing drugs. Psychotropic drugs are used to treat a broad array of conditions, from sleep disorders and pain to anxiety, depression, and psychosis. Psychotropic drugs exert their actions by either mimicking the effects, blocking the activity, or altering the storage, release, or uptake of neurotransmitters, signaling molecules in the brain that relay information between neurons and between neurons and other types of cells. Some psychotropic drugs restore the balance of neurotransmitters by preventing their breakdown once released from neurons. Examples of neurotransmitters that can be affected by psychotropic drugs include dopamine, gamma aminobutyric acid, GABA, norepinephrine, and serotonin. The 5 main classes of psychotropic drugs are distinguished primarily by the effects that result from their actions on neurotransmitters. Many anti-anxiety drugs, for example, are benzodiazepine compounds. Example, clonazepam, diazepam, which bind to neurons at locations near ion channels that admit chloride ions into the cell, and also near sites of action for GABA. GABA exerts inhibitory actions on certain neurons and thereby reduces the transmission of nerve impulses. Benzodiazepines generally enhance the effects of GABA, resulting in a calming effect. Other anti-anxiety drugs have similar physiological effects but do not act on GABA. Buspirone, for example, is thought to be a partial agonist of receptors for serotonin, the activity of which is associated with mood changes. Antidepressants comprise a diverse group of agents. They are divided into multiple classes. Among them, tricyclic antidepressants, monoamine oxidase inhibitors, MAOIs, selective serotonin reuptake inhibitors, SSRIs, norepinephrine norepinephrine reuptake inhibitors, NRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and atypical antidepressants which possess unique structural features and mechanisms of action. These drugs act by restoring chemical imbalances in neurotransmitter levels in the brain, thereby mitigating symptoms of depression, which result from reduced quantities or reduced activity of the monoamine neurotransmitters. Example: serotonin, norepinephrine, and dopamine. All antidepressants achieve their effects by inhibiting the body's reabsorption or inactivation of monoamine neurotransmitters, thus allowing the neurotransmitters to accumulate and remain in contact with their receptors for prolonged periods of time. These changes are thought to be important in elevating mood and relieving depression. Antipsychotic drugs are subdivided into typical and atypical antipsychotics. Typical antipsychotic drugs, sometimes also referred to as first-generation antipsychotics, work by blocking dopamine receptors. Examples include chlorpromazine, flufenazine, and haloperidol. The mechanism of action of atypical antipsychotics, sometimes called second-generation antipsychotics, is less clear, though they seem to inhibit various neurotransmitters, particularly acetylcholine, dopamine, norepinephrine, or serotonin. Examples of atypical antipsychotics include aripiprazole, clozapine, and iloperidone. Drugs used to stabilize mood work in various ways. Lithium, for example, reduces the excitatory activity of dopamine and glutamate and increases the inhibitory activity of GABA. Carbamazepine, an anticonvulsant drug, modulates inhibitory effects of neurons by altering the activity of voltage-gated ion channels, including those involved in the conductance of calcium, potassium, and sodium. Mood-stabilizing drugs are often used in the treatment of depression and bipolar disorder. Stimulant-type psychotropic drugs generally work by increasing levels of catecholamine neurotransmitters. Example: dopamine, epinephrine, and norepinephrine. This results in increased activity at the receptors for these neurotransmitters. Stimulants prescribed as psychotropic drugs are specifically used to treat attention deficit hyperactivity disorder. Side effects of psychotropic drugs vary markedly. For instance, whereas benzodiazepine drugs can be habit-forming and potentially cause dependence and withdrawal symptoms, buspirone has a much lower potential for abuse and is not associated with withdrawal phenomena. Side effects vary among the types of antidepressants and may include sleepiness, tremors, anxiety, loss of sexual desire, and nausea. Antipsychotic drugs are associated with many different adverse effects, including extrapyramidal symptoms, which can cause tremors, uncontrolled facial movements, or tics, muscle stiffness, and difficulty maintaining balance. Atypical antipsychotics increase the risk of diabetes, high cholesterol, heart problems, involuntary movements, and stroke. They tend to heighten the risk of suicidal thoughts among patients under age 18. Long-term use of stimulants can lead to dependence, and some individuals may experience an increase in heart rate or blood pressure, insomnia, poor appetite, and weight loss. I will read this section on neurotransmitter as well. Neurotransmitter: any of a group of chemical agents released by neurons, nerve cells, to stimulate neighboring neurons or muscle or gland cells, thus allowing impulses to be passed from one cell to the next throughout the nervous system. The following is an overview of neurotransmitter action and types. For more information, see nervous system. Neurotransmitter signaling. Neurotransmitters are synthesized by neurons and are stored in vesicles, which typically are located in the axon's terminal end, also known as the presynaptic terminal. The presynaptic terminal is separated from the neuron or muscle or gland cell onto which it impinges by a gap called the synaptic cleft. The synaptic cleft, presynaptic terminal, and receiving dendrite of the next cell together form a junction known as the synapse. When a nerve impulse arrives at the presynaptic terminal of one neuron, neurotransmitter-filled vesicles migrate through the cytoplasm and fuse with the presynaptic terminal membrane. The neurotransmitter molecules are then released through the presynaptic membrane and into the synaptic cleft. In milliseconds, they travel across the synaptic cleft to the postsynaptic membrane of the adjoining neuron, where they then bind to receptors. Receptor activation results in either the opening or closing of ion channels in the membrane of the second cell, which alters the cell's permeability. In many instances, the change in permeability results in depolarization, causing the cell to produce its own action potential, thereby initiating an electrical impulse. In other cases, the change leads to hyperpolarization, which prevents the generation of an action potential by the second cell. I'm going to just quickly click this section on action potential. Action potential: the brief, about 1/1000th of a second, reversal of electric polarization of the membrane of a nerve cell, neuron, or muscle cell. In the neuron, an action potential produces the nerve impulse, and in the muscle cell it produces the contraction required for all movement. Sometimes called a propagated potential because a wave of excitement is actively transmitted along the nerve or muscle fiber. An action potential is conducted at speeds that range from 1 to 100 meters, 3 to 300 feet per second, depending on the properties of the fiber and its environment. And I will leave it there. The termination of neurotransmitter activity happens in several different ways. The molecules may diffuse out of the synaptic cleft away from the receptive cell. They also can be taken back up into the presynaptic terminal via transporter molecules, or they may be metabolized by enzymes in the synaptic cleft. Types of neurotransmitters. Different types of neurotransmitters have been identified based on chemical and molecular properties. The major classes of neurotransmitters include amino acids such as glutamate and glycine, monoamines such as dopamine and norepinephrine, peptides such as somatostatin and opioids, and purines such as adenosine triphosphate, ATP. Some gaseous substances such as nitric oxide can also act as neurotransmitters, as can endogenous substances known as trace amines, which are related chemically to the monoamines. Examples include tryptamine and the phenethylamines. Acetylcholine, a substance synthesized by neurons, is the primary neurotransmitter of the parasympathetic nervous system, which controls smooth muscle contraction and blood vessel dilation, and slows heart rate. The major inhibitory neurotransmitter of the nervous system is GABA, gamma-aminobutyric acid, which acts to dampen neuronal activity. Abnormalities in neurotransmitter release and activity have been linked to various diseases and disorders, particularly neuropsychiatric and neurodegenerative disorders. For example, dysfunction of the neurotransmitters dopamine, glutamate, and GABA have been reported in schizophrenia, while reductions in levels and activities of norepinephrine and serotonin have been reported in persons with depression. Decreased levels of dopamine attributed to the loss of so-called dopaminergic neurons is a central feature of Parkinson's disease. So I'm going to just quickly click this section on action potential. Action potential. The brief, about 1,000th of a second, reversal of electric polarization of the membrane of a nerve cell, neuron, or muscle cell. In the neuron, an action potential produces the nerve impulse, and in the muscle cell, it produces the contraction required for all movement, sometimes called a propagated potential because a wave of excitement is actively transmitted along the nerve or muscle fiber. An action potential is conducted at speeds that range from 1 to 100 meters, 3 to 300 feet per second, depending on the properties of the fiber and its environment. And I will leave it there. From the National Institute on Drug Abuse, psychedelic and dissociative drugs. Highlights. Psychedelic and dissociative drugs can temporarily alter a person's mood, thoughts, and perceptions. Among other health effects and safety concerns, people who use these substances report feeling strong emotions, ranging from bliss to fear, and experiencing vast changes in how they perceive reality. In recent years, there has been growing research interest in the potential of psychedelic and dissociative drugs to treat medical conditions, including mental health disorders. An increasing number of people are also taking these drugs outside of medical setting for recreation, to improve well-being, or for spiritual or self-exploration. NIDA supports and conducts research to better understand the health effects of psychedelic and dissociative drugs, and to learn whether some of these drugs may help treat substance use disorders in medical settings. Over-the-counter medicines. Over-the-counter OTC medicines are those that can be sold directly to people without a prescription. OTC medicines treat a variety of illnesses and their symptoms, including pain, coughs, and colds, diarrhea, constipation, acne, and others. Some OTC medicines have active ingredients with the potential for misuse at higher than recommended dosages. Learn about the health effects of OTC medicines. Dextromethorphan, DMX, and loperamide, and read the drug facts on over-the-counter medicines. Once again, this is from the National Institute on Drug Abuse. Next, from the same source, prescription medicines. When used as prescribed by a doctor, prescription medicines can be helpful in treating many illnesses. Stimulants are helpful in managing attention deficit / hyperactivity disorder, ADHD, and narcolepsy. Central nervous system, CNS depressants treat anxiety, panic, and sleep disorders. Opioids are prescribed to treat pain, coughing, and diarrhea. But when these medicines are misused, they can have serious consequences. Next, from the same source, emerging drug trends highlights. Emerging drugs, which include designer drugs and new psychoactive substances, are substances that have appeared or become more popular in the drug market in recent years. Emerging drugs have unpredictable health effects. They may be as powerful or more powerful than existing drugs and may be fatal. Because drug markets change quickly, NIDA supports the National Drug Early Warning System, NDEWS, which tracks emerging substances. NIDA also advances the science on emerging drugs by supporting research on their use and on their health effects. Next, cannabis, marijuana, from the same source. Highlights. Cannabis refers to the dried leaves, flowers, stems, and seeds of the cannabis plant. The plant has many different chemical compounds, including tetrahydrocannabinol, THC, which has intoxicating, mind-altering effects. Cannabis products with THC can cause changes in mood, thoughts, and perceptions of reality. These products can also cause harmful health effects on the brain and other parts of the body. In recent years, there have been big increases in the variety of cannabis products and how much THC they have, as well as a greater variety of ways people can consume them. Unless mentioned otherwise, the information on this webpage is about cannabis products with THC. NIDA funds research on the health effects of cannabis products, including impacts on the developing brain and on mental health. The Institute also supports research on prevention and treatments for cannabis use disorder, the potential therapeutic uses of cannabis, and the public health impacts of cannabis policies. From the United States Drug Enforcement Administration. Stimulants. What are stimulants? Stimulants speed up the body's systems. This class of drugs includes prescription drugs such as amphetamines, in brackets, Adderall and dexedrine, in brackets, methylphenidate, in brackets, Concerta and Ritalin, in brackets, diet aids, in brackets, such as Didrex, Bontril, Preludin, Fastin, Adipex P, Lonomin, and Meridia, in brackets, and other illicitly used drugs such as methamphetamine, cocaine, methcathinone, and other synthetic cathinones that are commonly sold under the guise of, quote, bath salts, end quote. Street title: Bennies, Black Beauties, Cat, Coke, Crank, Crystal, Flake, Ice, Pellets, R-Ball, Skippy, Snow, Speed, Uppers, Vitamin R. How are they abused? Stimulants can be pills or capsules that are swallowed. Smoking, snorting, or injecting stimulants produces a sudden sensation known as a, quote, rush, end quote, or a, quote, flash. Abuse is often associated with a pattern of binge use, sporadically consuming large doses of stimulants over a short period of time. Heavy users may inject themselves every few hours, continuing until they have depleted their drug supply or reached a point of delirium, psychosis, and physical exhaustion. During heavy use, all other interests become secondary to recreating the initial euphoric rush. What is their effect on the body? Stimulants are sometimes referred to as uppers and reverse the effects of fatigue on both mental and physical tasks. Therapeutic levels of stimulants can produce acceleration, extended wakefulness, and loss of appetite. These effects are greatly intensified when large doses of stimulants are taken. Taking too large doses at one time or taking large doses over an extended period of time may cause such physical side effects as dizziness, tremors, headaches, flushed skin, chest pain with palpitations, excessive sweating, vomiting, and abdominal cramps. When used as drugs of abuse and not under a doctor's supervision, stimulants are frequently taken to produce a sense of exhilaration, enhance self-esteem, improve mental and physical performance, increase activity, reduce appetite, extend wakefulness for a prolonged period, and, quote, get high, end quote. Chronic high-dose use is frequently associated with agitation, hostility, panic, aggression, and suicidal or homicidal tendencies. Paranoia, sometimes accompanied by both auditory and visual hallucinations, may occur. What are their overdose effects? In overdose, unless there is medical intervention, high fever, convulsions, and cardiovascular collapse may precede death. Because accidental death is partly due to the effects of stimulants on the body's cardiovascular and temperature regulating systems. Physical exertion increases the hazards of stimulant use. These are images. Street dose of crack cocaine. More in broken up chunks. These are others in a rock form and then powdered form on the far right. Ritalin 5 milligrams, 2 tablets. Ritalin 10 milligrams, 2 tablets. And Ritalin 20 milligrams, 2 tablets. Methamphetamine, pink-colored meth, methamphetamine crystals. Dexedrine, 5 milligrams, 15 milligrams, and 10 milligrams. Bath salt powder, potpourri, bath salts, plant feeder bath salts. Cocaine powder, cocaine in more solid form, and then more so rocky. Looks like yellowish and white. And that's it for stimulants on the DEA website. Next is depressants, also on the DEA website. Depressants. What are depressants? But first, this is an image. Bottom one says Xanax. Depressants will induce sleep, relieve anxiety and muscle spasms, and produce seizures. Street title: Barbs, Benzos, Downers, Georgia Homeboy, GHB, Grievous Bodily Harm, Liquid X, Nerve Pills, Phennies, R2, Reds, Roofies, Ralphies, Tranks, and Yellows. How are they abused? Individuals abuse depressants to experience euphoria. Depressants are also used with other drugs to add to the other drugs' high or to deal with their side effects. Users take higher doses than people taking the drugs under a doctor's supervision for therapeutic purposes. Depressants like GHB and Rohypnol are also misused to facilitate sexual assault. What is their effect on the body? Slurred speech, loss of motor coordination, weakness, headache, lightheadedness, blurred vision, dizziness, nausea, vomiting, low blood pressure, and slowed breathing. Cause amnesia, leaving no memory of events that occur while under the influence. Reduce reaction time, impair mental functioning and judgment, and cause confusion. Next, returning to the National Institute on Drug Abuse, inhalants highlights. Inhalants are a class of substances that produce intoxicating chemical vapors that people inhale. These include products easily bought and found in the home, school, or workplace, such as spray paints, correction fluids, felt tip markers, glues, and cleaning fluids. Inhalants are most commonly used by young adolescents. People who use inhalants breathe them in through the mouth, huffing or bagging, or the nose, sniffing or snorting. Using an inhalant can cause severe health problems or even death. Inhalants can cause cardiac arrest or suffocation. Using these substances regularly can harm the brain, heart, kidneys, and liver. Next, from the same source, opioids highlights. Opioids are a class of natural, semi-synthetic, and synthetic drugs. These include both prescription medications used to treat pain and illegal drugs like heroin. Opioids are addictive. Use of opioids, either by themselves or in combination with other drugs, is a major driver of the drug overdose crisis in the United States. The vast majority of overdose deaths in recent years involved illicitly manufactured fentanyl and other potent synthetic opioids. These may be added to other drugs without a buyer knowing it. NIDA plays a leading role in the National Institutes of Health, HEAL, H-E-A-L, Helping to End Addiction Long-Term initiative, an effort to develop new scientific solutions to the overdose epidemic, including opioid and stimulant use disorders, and the crisis of chronic pain. From the same source, anabolic steroids and other appearance and performance-enhancing drugs, APEDs, highlights. Anabolic androgenic steroids are the best studied class of appearance and performance-enhancing drugs, APEDs, or APEDs. APEDs are used to improve appearance by building muscle mass or to enhance athletic performance. Although anabolic steroids and other APEDs may directly or indirectly have effects on a person's mood, they do not typically produce a euphoric high. However, people who use these substances may develop a substance use disorder, defined as continued use despite adverse consequences. Anabolic steroids can cause severe, long-lasting, and in some cases irreversible damage. They can lead to early heart attacks, strokes, liver tumors, kidney failure, and psychiatric problems. In addition, stopping steroid use can cause depression, often leading to resumption of use. from the National Institute of General Medical Sciences. Anesthesia. What is anesthesia? Anesthesia is a medical intervention that prevents patients from feeling pain during procedures like surgery, certain screening and diagnostic tests, tissue sample removal, example, skin biopsies, and dental work. Anesthesiologists are doctors who have been specifically trained to give medicines used for anesthesia, which are called anesthetics. Depending on the type of pain relief needed, anesthesiologists can deliver anesthetics through several methods. Gas that the patient inhales through a mask covering the mouth and nose, intravenous line with a needle inserted into a vein, giving direct access to the bloodstream, catheter, thin tube, inserted into the space outside of the spinal cord or around the peripheral nerves, injection into a body part with a needle and syringe, topical lotion or spray, eye drops, skin patch. Before the introduction of safe and effective anesthetics about 175 years ago, surgeries of any kind were rare, dangerous, and only used as a last resort. Patients who underwent surgeries at this time did so fully conscious. Now, advances in anesthesia have allowed for life-saving surgeries that would be impossible otherwise. Surgeries to treat cancer, organ transplants, and open heart surgery are only a few types of the important techniques anesthesia has made possible. Modern anesthetics are typically very safe, but there are risks involved, including breathing problems, allergic reactions, and general confusion after surgery.